In Switzerland, about 100 people die every year because they don't receive a new organ in time to save them. The number is rising. The Swiss National Foundation for Organ Donation and Transplantation, Swiss Transplant, says the number of deaths is particularly high in the German-speaking regions because of a failure to communicate properly with families when their loved ones die. In areas where cantons fund training for expert advisors on organ donation, the success rate is higher.
In the French and Italian-speaking areas, we have a network of specially trained staff in every hospital. The training is financed by the cantons. The establishment of this kind of structure in hospitals has proven sustainable. Organs are being donated. The German-speaking regions are not achieving the same successes.
Swiss TV wanted to find out more about how the system works in French-speaking Lausanne. This is Sylvie Cluzet, who has been working in intensive care in the city's university hospital for 10 years. 3 years ago, she took on a new role as organ donor coordinator. Her job is to identify people who are brain dead and to contact their nearest relatives.
Our role is to support the transplant teams in their work. With our specialist knowledge of the subject, we can give precise answers to the families involved if they have any questions.
Local coordinators were appointed by the organ donor programme PLDO, which covers 17 hospitals in the French and Italian-speaking parts of Switzerland. Thanks to its success, the number of donors in this region has risen by 70% since 2008.
We identify the potential donors, then we have to get the consent of the families to use the organs. About a quarter of them refuse, which is the average rate for Europe.
Jean-Yves Morev is among those who gave his consent. His son Romain lost his life in a car accident at the age of 20. He says it's important that the person who makes the request is well trained.
It's really important because after hearing terrible news like that, you're in a state of shock. And a couple of hours later, they're asking to take the organs out of your son. It's really tough.
It's so difficult that an actor was brought in to help coordinators improve their communication skills.
Sometimes there's a new shift of medical staff on duty. It's a long day. The staff go from one sick person to another, one crisis to another. You have to be sure that a personal relationship already exists at the moment that the request is made.
In this service, life and death are inextricably linked. When the patient is brain dead, it allows another person to survive.
We do feel sorry for the patient who's died, but at the same time, there are several patients waiting to receive an organ to improve their lives.
It wasn't of any immediate help to us in dealing with our grief, but I was sure that in the medium and long term, it would be something that would help us a lot. Just to know that there are people out there who recovered and are alive today because of our son. That's what helped us accept his death.